Right. Let's unpack this. Today, we're taking a deep dive into something you might not have heard of, but it's really crucial for understanding horse health: equine erythrocytosis.
Right.
You might know it by maybe a simpler name, polycythemia, but we'll get into why erythrocytosis is often, well, more accurate.
Yeah, the terminology matters here.
We've pulled together a stack of really fascinating sources, vet research papers, clinical guides, all to get a handle on what happens when a horse just has too many red blood cells.
Mm-hmm.
Our mission today is to cut through the jargon, really pull out the most important bits, and give you a shortcut to, being well-informed on this condition.
Sounds good.
Now, you might think, okay, more red blood cells, more oxygen. That sounds good, right?
Seems logical.
Well, here's where it gets really interesting and maybe a bit counterintuitive. When it comes to a horse's blood, too much of a good thing, that can quickly become a serious problem.
Yeah, it absolutely can. What's fascinating here is that very paradox. It seems like it should be beneficial, but an excessive concentration of red blood cells, it actually makes the blood too viscous.
Viscous, like thick.
Exactly. Think of it like trying to pump, say, thick syrup through really delicate pipes. It just doesn't flow well.
Right?
And this impairs blood flow. It significantly ramps up the workload on the heart, and it can lead to a whole host of serious clinical problems. Understanding this fundamental issue, the viscosity, that's really key to grasping the whole condition.
Okay, that thick syrup analogy really helps. So if the blood gets that thick, the first crucial step, I guess, is figuring out why. The sources say we need to differentiate between the types.
Definitely. Their causes, what they mean clinically, the treatments, they differ wildly.
Mm-hmm.
We're looking at two main categories, relative erythrocytosis and absolute erythrocytosis.
Yeah.
So let's start with relative erythrocytosis. This is by far the most common type vets run into.
The most common.
Okay. Yeah. And this isn't a true increase in the total number of red blood cells in the horse's body.
Oh.
It's more like a perceived increase.
Perceived. How so?
Because the plasma volume, the fluid part of the blood has decreased, so the cells become more concentrated in the sample you test.
Ah, so it just looks like there are more because there's less liquid.
Precisely. The overall number hasn't actually changed.
Okay, that makes sense. And the most frequent cause of that is dehydration, right?
Spot on. If a horse loses plasma water, maybe from severe diarrhea, profuse sweating, not drinking enough, even a high fever, those existing red blood cells just get packed tighter together.
Right.
And the diagnostic nugget here, the thing to look for in blood work, is that this kind of dehydration is typically accompanied by both an elevated packed cell volume, the PCV,
Okay.
and an elevated total protein, or TP, level. Seen both of those high together. Strong sign of dehydration causing relative erythrocytosis.
High PCV, high TP equals likely dehydration. Got it. But here's something else I found really fascinating. Splenic contraction.
Ah, yes. The equine spleen.
I mean, did you know the horse spleen is this huge muscular organ? And it can store, like 30–40% of the horse's total red blood cell mass?
It's incredible, isn't it? And this contraction, it's a completely normal physiological response. Think of it as a built-in blood reserve.
Blood reserve? For what?
For moments of excitement, fear, pain, or intense exercise. The spleen squeezes down, contracts, and releases all these stored red blood cells into the general circulation.
Wow.
And this can cause a really rapid but temporary jump in PCV. You could see it go from, say, a normal 35% up to 50%, even 60%.
That high, just from stress.
Yep. But here's the key difference from dehydration. The total protein level doesn't usually go up with splenic contraction.
Okay, so high PCV, normal TP, could be the spleen just reacting.
Exactly. It's not a disease state, but it's absolutely vital to recognize because, well, a stressed horse getting a blood draw could easily look like it has polycythemia if you don't consider the spleen.
That's a huge point. It really shows how a horse's body can shift so fast.
It does. Very dynamic.
Okay, so that's relative erythrocytosis, dehydration, or the spleen. Now let's pivot to absolute erythrocytosis.
Right. Now we're talking about a true increase in the total red blood cell mass.
So the body is actually making more cells.
Correct. It stems from increased red blood cell production, usually in the bone marrow. This is way less common than the relative type, but generally more serious.
Okay. And there are subtypes here too.
Yes. Two main ones. First, there's primary erythrocytosis, which you might also hear called Polycythemia vera.
Polycythemia vera.
Okay. This is really rare in horses. It's a type of myeloproliferative disorder, basically, a bone marrow problem. The marrow just starts churning out red blood cells like crazy on its own.
On its own, like ignoring the body's signals.
Exactly. It's autonomous. It's not responding to the normal stimulus, the hormone erythropoietin, or EPO.
Hmm.
So red cell production is sky high, but the EPO levels in the blood are typically low, or maybe normal. The factory's gone rogue.
Wow. Okay, that sounds serious. What's the second subtype?
That's secondary erythrocytosis. And here, the increased red cell production is driven by an increase in EPO.
Ah, so the signal is there, it's just too strong or inappropriate.
Precisely.
Yeah,
And it
babe.
can be either appropriate or inappropriate.
Okay, let's break that down. Appropriate.
Appropriate secondary erythrocytosis happens when the body needs more oxygen. There's chronic tissue hypoxia, a long-term lack of oxygen getting to the tissues.
Like from lung problems.
Exactly. Severe chronic lung disease, like advanced heaves, is a classic cause.
Mm-hmm.
Or congenital heart defects, where blood bypasses the lungs. We call that right-to-left shunting. Even living at really high altitudes for a long time.
What's 7,000 feet, something like that?
Yeah, around 2,200 meters, or
Yeah.
7,200 feet. The body senses low oxygen and ramps up EPO production to make more red cells, trying to compensate and boost oxygen carrying capacity.
So the body is trying to help, but maybe causing other issues with the thick blood.
That's the dilemma. Is the compensation helpful or harmful overall?
Right. Okay, so that's appropriate. What about inappropriate?
Inappropriate secondary erythrocytosis when EPO levels go up, but there isn't any systemic hypoxia. The body doesn't actually need more oxygen, but it's getting the signal to make red cells anyway.
What causes that?
The most common culprits are EPO-secreting tumors, usually in the kidney, but sometimes elsewhere, like the liver or associated with lymphoma.
So a tumor is just pumping out this hormone.
Exactly. Ectopically producing EPO. Other causes can be certain non-cancerous kidney diseases that cause localized hypoxia just within the kidney, tricking it into making EPO. Or even giving the horse EPO from an outside source.
Like doping in racehorses.
Unfortunately, yes. That's been known to happen, and rarely some hormonal imbalances can also play a role.
Okay, wow. So a lot of potential causes. What does this actually look like in the horse? When do you start seeing signs?
Well, the sources suggest that clinical signs, especially with the absolute types, generally don't really become obvious until the PCV gets quite high, maybe exceeding 60–65%.
That's pretty high.
It is. That's when the blood viscosity really starts causing noticeable problems.
And what are those problems? What do you see?
You'll often see general signs of hyperviscosity first. The horse's gums, the mucous membranes around the eyes, they'll look very dark red, almost brick red. Congested is a good word for it.
Because the blood's not moving well.
Exactly. Their heart rate might be up tachycardia because the heart's working overtime to pump that thick sludge. They can seem lethargic, weak, tired.
Yeah.
Performance drops off noticeably, especially in athletes.
Makes sense.
And in really severe cases, they might even become recumbent, unable to stand.
Gosh. Are there more specific signs than just general sluggishness?
Oh, yes. Because blood flow and oxygen delivery to the brain can be reduced. You might see neurological signs. Things like ataxia in coordination.
Like being wobbly.
Yeah, wobbly. Or seizures, changes in behavior, maybe depression, maybe unusual excitability, even blindness in some cases.
Blindness. Wow.
But here's something really strange, almost paradoxical. Horses with severe erythrocytosis can sometimes develop bleeding tendencies.
Bleeding. With too many cells. How does that work?
It sounds completely backward, doesn't it? But the increased viscosity can actually mess with platelet function the cells needed for clotting.
So they don't clot properly.
Right. And at the same time, the high pressure from the thick blood pushing through fragile capillaries can cause them to rupture. So you might see nosebleeds, epistaxis, or even bleeding in the gut.
It's like the blood is too thick to clot, but also pushing too hard on the pipes. Wild.
It is. And there's also an increased risk of the opposite problem, thrombosis, or blood clot formation.
So clots and bleeding.
It's a dangerous combination. These clots can lead to really serious issues like laminitis, patches of skin dying off focal cutaneous necrosis, or even kidney failure.
Okay, this sounds incredibly complex. And then you might also see signs of whatever caused the secondary erythrocytosis in the first place.
Absolutely. If the underlying issue is dehydration, you'll see those tacky gums, maybe skin tenting. A heart murmur might point towards cardiac disease. A chronic cough suggests lung issues. And if it's a tumor, you might see weight loss, poor appetite. There's more general signs of neoplasia.
So if a horse shows up with some of these signs, how does a vet actually figure out which type it is and what's causing it? What's the diagnostic path?
It's a systematic process. The first step is always that complete blood count, CBC.
Blood tests.
That confirms the high PCV, high red cell count, high hemoglobin. But crucially, you look at the total protein, TP, again,
Okay.
High PCV and high TP point strongly towards dehydration relative erythrocytosis.
And high PCV but normal TP.
That tells you it's likely either splenic contraction or true absolute erythrocytosis. So the TP level is a key initial branch point.
Okay, CBC first. What's next if TP is normal?
Next is a thorough hydration assessment. Look at the horse clinically, skin pinch, gums, and often you'll give fluids and see if the PCV comes down.
To rule out subtle dehydration.
Exactly. And to exclude splenic contraction, you typically repeat the PCV test after the horse has had time to rest and calm down, maybe with mild sedation if needed, if the PCV normalizes then.
That was just the spleen reacting to stress.
Precisely. Splenic contraction confirmed.
Okay, so if the PCV stays high, even after rest and fluids, then you're likely looking at absolute erythrocytosis.
That's when you really start digging deeper for the underlying cause of absolute erythrocytosis. Measuring oxygenation status becomes critical.
Checking oxygen levels. How?
Usually with an arterial blood gas analysis. This checks the PA2, the oxygen level in the arterial blood. If it's low, that indicates hypoxemia.
And low oxygen would suggest.
It would suggest an appropriate secondary erythrocytosis. The body's responding to a real lack of oxygen.
Okay. What else? Imaging.
Definitely. Echocardiography and ultrasound of the heart can look for those congenital defects. Chest x-rays or ultrasound evaluate the lungs for disease. And if you suspect a tumor...
Abdominal ultrasound.
Exactly. Abdominal ultrasound is key for looking for kidney masses or other tumors that might be producing EPO.
And what about those EPO levels themselves? Can you measure those?
Yes, measuring serum erythropoietin, EPO levels, is a really important test in these cases. It helps differentiate the absolute types. Well, if the EPO level is normal or low, despite the high red cell count.
That points to the primary type, Polycythemia vera, where the marrow's gone rogue.
Correct. The signal isn't telling it to overproduce, but it is anyway. But if the EPO level is high...
It's secondary erythrocytosis, either appropriate or inappropriate.
Right. And then you combine that with the oxygen status. High EPO plus low oxygen, hypoxemia. That fits with appropriate secondary.
Body trying to compensate.
Yep. But high EPO without hypoxemia. That strongly suggests inappropriate secondary erythrocytosis.
Likely an EPO-producing tumor.
That's the most common cause in that scenario. It's a really neat diagnostic pathway when you put it all together. And very rarely, if you strongly suspect primary erythrocytosis but need confirmation, a bone marrow biopsy might be done.
Okay, quite a workup. So once you have a diagnosis, what can you actually do? Treatment must depend entirely on the cause, right?
Absolutely. There's no single treatment. For relative erythrocytosis, it's pretty straightforward.
Fluids for dehydration.
Aggressive fluids, yes. Restore that plasma volume. And, of course, treat whatever caused the dehydration in the first place. The diarrhea, the fever.
And if it was just splenic contraction?
No specific medical treatment needed. It's physiological. Maybe try to minimize stress during handling or vet visits if it's a recurring issue on blood tests.
Okay. What about the tougher ones, the absolute erythrocytosis cases?
Here, the main goal is always, if possible, to identify and treat the underlying cause.
So for the appropriate secondary type, where the body needs oxygen,
you focus on treating the underlying heart or lung disease. Improving oxygenation is the key. You might even accept a slightly higher PCV in these cases, because it is helping the horse cope with low oxygen.
Right, it's compensatory. And for the inappropriate secondary type, like from a tumor?
If it's an EPO-secreting tumor, surgery to remove it is the ideal treatment, assuming it's possible and hasn't spread.
Okay. But what if you can't fix the underlying cause? Or if it's the primary type, Polycythemia vera, are there ways to just manage the thick blood itself?
Yes, that's when we turn to symptomatic treatments. The main one is phlebotomy.
Therapeutic bleeding, like bloodletting.
Essentially, yes. Therapeutic bleeding. You remove a specific volume of blood, usually from the jugular vein, to directly reduce the red blood cell mass and lower that dangerous viscosity. This can alleviate the clinical signs quite effectively.
Do you just take blood out? Doesn't that cause other problems?
Good point. Critically, you need to administer 5E fluids at the same time you remove the blood. This replaces the lost fluid volume and prevents the horse from going into shock or becoming hypovolemic.
Okay, so remove blood, replace fluid.
Yeah.
Got it. Does it need to be done often?
It might need to be repeated periodically, depending on how quickly the red cell count climbs back up.
Yeah.
But importantly, phlebotomy is contraindicated. You absolutely don't do it in relative erythrocytosis.
Because that would just make dehydration worse.
Exactly. And you use it cautiously in appropriate secondary cases, because you don't want to completely remove the body's compensation for hypoxia.
Okay. Are there medications involved too?
For primary erythrocytosis, polycythemia vera, yes, we can use myelosuppressive drugs like hydroxyurea.
What does that do?
It inhibits DNA synthesis, so it suppresses the bone marrow's excessive production of red blood cells. This can reduce how often you need to do phlebotomy, but it requires careful monitoring, regular blood work.
Makes sense. Anything else? What about those clots?
If there's a high risk of thrombosis, blood clots, then antiplatelet drugs like aspirin or other anticoagulants might be considered. But their use is a bit controversial and needs very careful monitoring because, as we said, these horses can sometimes have bleeding issues too. It's a fine balance.
Definitely sounds like it. Okay, finally, let's talk outlook. What's the prognosis? If a horse gets diagnosed with this, what are we looking at long term?
It really, really varies. It depends entirely on the type and the specific underlying cause.
Okay. What about the common one, relative erythrocytosis?
For relative erythrocytosis, the prognosis is generally excellent. You fix the dehydration or the excitement passes, and the PCV normalizes. Full recovery is expected.
That's good news. What about the true polycythemias, the absolute types?
It's a more serious picture there. For appropriate secondary erythrocytosis, the prognosis hinges on how severe the underlying heart or lung disease is and how well you can treat that.
So if the underlying disease is manageable,
Then the prognosis for long-term survival can be fair, but athletic performance is usually limited. For inappropriate secondary erythrocytosis, usually caused by those tumors,
prognosis isn't great.
often guarded to poor, unfortunately, especially if the tumor can't be completely removed or if it's already spread, metastasized.
Okay. And what about that really rare primary form, polycythemia vera?
For primary erythrocytosis, polycythemia vera, the prognosis is generally considered guarded to fair. It's not curable, but it can often be managed.
With the phlebotomy and drugs?
Yes, with therapeutic phlebotomy and maybe myelosuppressive drugs like hydroxyurea, you can often maintain a reasonable quality of life for months, sometimes even years.
But there are still risks.
Yes, long-term complications from the hyperviscosity like thrombosis or hemorrhage can still happen, which really underscores why getting that accurate diagnosis is so critical for any horse with a persistently high red cell count that isn't just simple dehydration or a splenic reaction.
What a deep dive that was. Wow. From the common, usually manageable things like dehydration and that surprising spleen effect,
Yeah, the spleen is amazing.
all the way to these rare, really serious conditions like polycythemia vera or those EPO-secreting tumors, it's definitely clear that too many red blood cells is far from a simple thing in horses.
Not at all.
We've really unpacked how something that seems beneficial, like having lots of oxygen carriers, can actually flip and become detrimental, making the blood dangerously thick.
Hmm.
And we've seen the complex detective work veterinarians have to do, navigating that diagnostic path to pinpoint the exact cause. Because, as you said, the treatment absolutely hinges on knowing why it's happening.
It really does. And, this raises a fascinating question for you, the listener, to think about. When we see how the body constantly adapts storing blood cells for fight or flight, making more red cells when oxygen is low.
Right, these amazing adaptive mechanisms.
Exactly. And yet even these vital adaptations can, in rare cases, go awry and lead to complex conditions like erythrocytosis. What does that tell us about the incredibly delicate balance that's required for health, not just in horses, but in any complex biological system, including our own bodies? Think about the constant, unseen work your body is doing right now just to maintain that perfect equilibrium. That's quite something.